One night, Sarah and Jennifer went out to the movies. They met a bunch of friends, had supper, and went to the movie theater, just for a night out, to get away and have some fun. They had one of the best nights of their lives. After the movie, it was raining. Sarah's mother called and told them to be careful since it had been raining for so long. On the way home, they were jamming out and not paying much attention to the road. A car heading in the opposite direction started to hydroplane and was headed right towards them. They didn't notice until it was too late. The girls ended up in a terrible accident. Both of them had a serious injury, but Sarah's was the worst, and she would need surgery soon. They were immediately rushed to the hospital. Both of them had lost a lot of blood. Jennifer was type O positive, the most common blood type, but Sarah was type AB negative, the rarest. The hospital the girls were sent to had a very low blood supply. Yes, they had the types they needed, but not enough. Sarah needed a life-saving surgery, but was unable to receive it because there wasn't enough type AB negative to get her through surgery. Sarah died that night, all because of an extremely low blood supply. All over America, the blood supply is especially low during the summertime. According to the Red Cross in article Blood Facts and Statistics, over 30 million blood components are used every year. That comes out to 44,000 blood donations that are needed every single day. The components are used for various reasons. Major surgeries often require a lot of blood. Some surgery patients are able to donate their own blood for the operation if they know ahead of the time. But not all patients know in advance to give their own blood. Patients who need immediate life-saving organ transplants require a lot of blood during the transplant. They would be unable to use their own blood because of the large amount needed. Accident victims who have lost a lot of blood may need transfusions. People with sickle cell anemia need blood transfusions regularly, and every single transfusion requires 3 pints of blood. It is clear that the blood shortage is a serious problem. The adult body has about 12 pints of blood. The body, after giving blood, will replace the blood within 48 hours. It only takes 8 weeks to replace your red blood cells. You have to wait 56 days in between giving. You can't give until that 56 days is up. People don't give because they think they are too busy, or that they can't give, or that it's just a mental thing. People can't actually give because of an illness such as anemia.
I didn't do that.
Some reasons you can't give is because you are being HIV positive, having high blood pressure, cancer, or heart disease, or any serious health problems. Some athletes may think that they can't give because it won't peak when they perform, or something may not go right when they're performing at the event. In some countries, you get paid to donate, but in the U.S., you volunteer. Only 37% of the U.S. population is eligible to donate. According to the American Blood Organization, only 5% of people actually give out of that 37%. They are low on blood because red blood cells only have a shelf life of 42 days and plasma only 5. This is why the supply has to keep being replenished even if all the blood isn't used. Some people don't give because they have a mentality that they don't need to because other people will, and they don't think that they need to contribute, and why should they? Family or friends also need transfusions. So you may know someone around you that needs a transfusion or that has previously had a transfusion. You can donate one day, and the next day your blood can be on its way to saving 3 people's lives. How awesome is that? Some of the qualifications you need are you need to be 17 years old or 16 years old with a parent consent. You must weigh 110 pounds and have a healthy iron level, and it will only take up to an hour of your time to donate. Then you will get started once you meet the qualifications. Also, people are afraid that needles, or they might faint at the sight of blood when they help things out as well. There are still many other ways you can help out. Donate your time. Help work at a local blood drive. You can do this by hanging up flyers, calling people and getting appointments set up, or simply making goodies to the donors to enjoy after their donation process. We need a larger blood supply because accident victims, people undergoing major surgeries, and people that have diseases such as sickle cell anemia, and need transfusions to stay alive. Only a small portion of the population can even donate. While some people have health problems that don't allow them to donate, other people think they are just too busy. Blood and plasma both have short shelf lives, so the blood supply constantly needs replenishing. Everyone that is over the age of 17 and is healthy should go and donate because more than 95% of you will have a relative or friend that needs a blood transfusion at some time in their life. Just go out and donate. If you're eligible to donate, then donate your time. Every little bit helps. Just think, if you go out and donate your blood, it could be your life, a family member's life, or even a best friend's life that you are saving.